Dr. Seeta and I'm a fetal medicine consultant. Today we're going to discuss about the importance of fetal growth assessment in pregnancy. And when do we do it? Why do we do it? Now, when a mother conceives, we know that the entire 9 months of a pregnancy, the baby is developing and growing inside. The first 8 weeks is when the baby's organs are all formed, and then the baby continues to grow after that. But it's only in the later part of pregnancy, that is after 20 weeks or 24 weeks, we tend to assess how the baby is growing. So typically, a growth scan is done anytime from 26, 28 weeks onwards, and it can be done obviously until delivery. Now, there are various reasons when we need to do a growth scan. Sometimes, usually, it is done routinely, like for all babies that are growing. We need to know if this baby is growing properly throughout pregnancy. Earlier, when ultrasound was not available, all the doctors used to feel the tummy and see whether this baby is actually growing in size or not. But sometimes that can be misleading. So nowadays, routinely also for all pregnant women, we advise a growth scan somewhere around 32 to 34 weeks, at least one growth scan, or at 36 weeks, just to make sure that this baby is growing properly, because on ultrasound there are certain parameters which can tell us exactly how this baby is growing and what the baby's weight is. Why are we worried? Because some babies which are not growing properly, they might have problems inside, and you might end up in sudden unexplained intrauterine fetal demise, as we call it, towards the later stages of pregnancy. And one of the commonest cause of this late stillbirth or late intrauterine fetal death is growth restriction. And this is the reason we need to pick up those cases to diagnose the babies that are not growing properly. When do we need to do fetal growth assessment? As I said, we can do it routinely for all women, either at 32 or 36 weeks. Secondly, if there are any problems in the mother, like if she has diabetes, if she has blood hypertension, if she has other problems like sometimes blood disorders in her, or if she's kidney problems, any medical disorders in the pregnancy, if she has anemia, any of these can affect the baby's growth and we need to assess them. So the growth assessment actually starts from the anatomy scan, which is at 20 weeks. That is also a benchmark as to see this is where the baby is growing and the potential for the baby to grow in subsequent scans. So in high risk patients, as we call it, we do the growth scan every 4 weeks, that is at 28 weeks, at 32 weeks, and one just before delivery at 36 weeks. Sometimes during the growth scan, if we find that there is a problem, that the fluid is less or the growth is less, and associated with that, the blood changes, that is, we call the Doppler changes, are there, then we might have to increase the frequency of the scan to every 2 weeks or 1 week, depending on what abnormalities we find during the scan. And then ultimately, sometimes if the growth is so bad that we need to deliver the baby, that is also ultrasound helps us, because that will tell us indications. Yes, the baby is not getting enough blood supply, or the blood supply is so bad that if we leave the baby might succumb inside. So that is why the fetal growth assessment is important. Sometimes in cases of fetal problems we need to do regular growth assessment. That is, if the baby is found, especially in twins. In twins, you cannot clinically assess if both the babies are growing from outside very well. So in twins, depending on the type of twins, that is something called chorionicity, we do the measure growth assessment of these twins every 2 weeks or every 4 weeks, depending on what the type of twinning is. So for certain fetal problems also we need to do these growth assessment. So growth assessment is very, very important because it checks the potential of the baby, how much it's growing. It tells us the weight of the baby, estimated fetal weight, which is not always exact. It is an approximate fetal weight, and then accordingly, if there are any problems, we can tell the we can guide the patient and guide the clinician as to when exactly the baby needs delivery. So, as we say, every anatomy scan is also a growth scan, and every growth scan is also an anatomy scan where they look at other things in detail. Thank you so much.